Good morning. Thank you for joining us. I have with us Endometriosis Summit faculty member and physical therapist, Amanda Olson. Amanda also owns a company, Intimate Rose, which may provide a lot of help for those of you out there because they do a lot of stuff that could help you at home with pelvic pain and pelvic floor dysfunction. Amanda, how did you like the Endometriosis Summit?
Oh my goodness, that is the best time I've had in a long time. It was such a good time. Great talks, wonderful people. I think everyone had a really great time.
What did you learn the most? What's the number one thing you learned at the Endometriosis Summit?
Well, I learned a lot about what some of the common practices in terms of medications were, and what some of, the things that I had been seeing locally were, there was a lot of discussion about Orlisa and some of these different medications. And so I definitely had a better appreciation for what these leaders in endometriosis are doing in terms of that. And then I think just hearing, everyone's stories, I see endo patients, I see a lot of patients that have had a lot of surgeries anyways, but I think that endometriosis patients are just some of the most resilient, strong, amazing people on this planet. So it was just so lovely to be around everyone. I made some really great new friends and it was wonderful.
Yes, we were so happy to have you. And the plan originally was to go to you and to head to Seattle for next year. But we really don't know what the plan is. What we do know is that likely we're going to have a reproductive immunology conference, which was originally supposed to be October in New York. And we've managed to get out of our contract for that. That will be moved entirely online. So while there will be a fee to attend, it won't be like this. There will be a fee to attend. That will be an online conference, so everybody can get there. And actually this morning, I just had a meeting with the platform that's going to host it. So that's going to move forward. And then in terms of a big one, I don't know what we're going to do. We'll have to see what happens to life. But we just snuck it in. We just snuck it in before there was a problem. Could you imagine?
I couldn't imagine. And I've talked with so many colleagues, I'm looking at these pictures of you and me and Tracy and some of these other providers, and we're so happy and we're hugging each other. And it's like, that was 3 weeks ago. Like, I can't believe how drastically life has changed. Like, we were all together and so happy, and things are so different now.
I have a very hard time with it because last year after the event, within 10 to 15 days, my intestines were on the wrong side of my abdominal wall, and I had a major hospitalization and ordeal, and trying to recover was very hard. I had a lot of complications. So I washed out 2019 Summit in my brain because it came with that. And then I had such high hopes that this one I'll take in and I'll enjoy every moment and I'll feel it. And now I've done almost the same thing because you have that trauma response of trying to, I looked at the pictures once. Actually, so it's a hard thing. I wish I could take it in more. I think maybe as time goes by, I will.
Little
but
by little.
We have a huge problem in endometriosis in that no one can get to care. Right. And so I have done everything I can to bring professionals to the Endometriosis Summit crowd. And you, with Intimate Rose and the Pelvic Wand and your videos, have the secret, I think, for a lot of our patients at home, a lot of people at home suffering. And so I wanted to talk, I know you've been on before and you've talked about the tools, but I wanted to talk about them again. And I know that you've made a special code so that our listeners can order and get some help at home. We wanted to talk about how to use it, but also I want to talk about the video library because I've had very good feedback from my own caseload. My patients have bought the tool and gone right to the video library. So we want everybody to know that this resource is out there from them. Amanda, what is the Pelvic Wand?
Sure. So the Pelvic Wand, there are two, is a device that allows you to go inside either the vagina or the rectum to do some gentle mobilization of the muscles and the fascia, or trigger point release for people that have pain. So it's got some really special curvatures here. The purple one is still, the turquoise one vibrates, 10 different frequencies of vibration on that one, that allows you to kind of come in and reach the nooks and crannies of the pelvic floor muscles to be able to relieve some of that pain on your own. So the tool was created for people to be able to treat on their own. Ideally, usually a pelvic physical therapist has performed an evaluation and educated them on where they live and all of these kinds of things. So, now many of our colleagues are on telehealth and they can provide, different models and demonstrate the use, which we'll do here in a little bit. So if you have access to a pelvic PT with telehealth, that's ideal. And if not, I have the video library.
I'm seeing telehealth patients, and are you?
A little bit, yeah, a little bit.
So most people out there seeking pelvic PT are able to find a telehealth PT. We offered a phenomenal rate, which I didn't realize there were so many that couldn't get good pelvic PT that have reached out. So it turned out to have a little good thing. But I wanted to show, let's see if as long as I don't crash, but I wanted to show you. This comes from the Global Pelvic Health Alliance membership program. And when you're a member, you get to view these illustrations that Pelvic Guru and GFAM has drawn. But also for those that, don't worry, I'm working on it. For those of you that have never seen the pelvic floor, we wanted to show you what the pelvic floor looks like. So this is the more superficial pelvic floor here, and you can see across here is the transverse perineal muscle. For lots of people that have pain at penetration, it may be coming from that muscle. What else, Amanda, might be coming from that muscle?
If people are experiencing constipation, the way that transverse perineal comes in and attaches then to the muscle around the sphincter, they can be having issues there, certainly, and then also pain with sitting.
Right, and a lot of people who have some burning, or it may be because you see where everything meets is very, very tight. So the wand could be helpful for that, couldn't it be?
Yeah, absolutely. So here, I'm going to take my organs out. So organs sit so nicely in that pelvic floor. I'm going to take them out so I don't dump them here.
All right, wait, so you all can see Amanda. I'm going to stop the share for just a second. And so then she'll be nice and big. Awesome, nice and big.
There we go. Yep, and so wand can be used on those superficial muscles here. And then down on the perineal body here, either end.
Right. So I reminded someone on telehealth during a session yesterday that the wand doesn't have to go inside. What Amanda showed you, show again, was really, really important. Is that the wand works on the outside too. And so you can mobilize a lot of those areas, particularly if you have any pain with constipation, or any pain or any urinary difficulties, any pain with penetration. You can use the tool. I usually flip. If I were using it, I would flip because I'm smaller. It's easy on, right? Amanda's tiny too. So like, that's a smaller side. We're not picky about what side that you use. And the other thing is, I believe that Intimate Rose also sells the vulvar balm, right?
Yes.
Yes. So when you use the wand, you could use the vulvar balm. I'll just point as if you're standing here, even though we're on this thing. So you can use the vulvar balm to mobilize that tissue also. But the other thing is, what do you usually use for lubrication with the wand? Some people say just water. Some people say a CBD lube. What do you usually use?
Sure. A natural coconut oil or a water-based lubricant, essentially anything except for a silicone-based lubricant, because the silicone-based lubricant can interfere with our medical grade silicone on the wand. But any of those are totally acceptable.
And big discussion in the global group, is coconut oil bad for the microbiome of your vagina?
Sure. Yeah, I know that. I think if people have a tendency towards overgrowth anyways, that it certainly can be. And I know some people have negative effects from it. So I think it just comes down to individual pH. So trying to find a good lubricant that matches your pH, that doesn't leave you itchy or dried out or anything like that.
Right. It's interesting, at the Endometriosis Summit, Dr. Vidali was very against the ones with glycerin in it.
Right.
I find the ones like slippery stuff are the purest ones. And some people do really well. So it depends on the individual person's body.
Totally.
I don't know if the CBD ones are silicone based, but sometimes that has that extra muscle relaxant. So especially if you're not going inside, if you're just doing the outside, that could be really good too. So let me bring you back to the pelvic floor. Everybody's doing good. By the way, Zoomers, unlike Facebook where we're able to take questions the whole way through, if you look down in that Q&A part of your screen, if you put your questions there, we'll try to get to your questions. So we'll go right back to our screen if we can, coming from the Global Pelvic Health Alliance membership site. And you can see these are all, a Pelvic Guru has designed these. And I wanted to show the inside, the more deeper layers of the pelvic floor. And you can see here somebody's doing an exam, but it really gives you, this is as if the body is cut off and we're looking down. And it really gives you a view for anyone who has not seen their own pelvic floor. It gives you a view on the side wall. You have obturator internus, right? And obturator internus has this funky thing in that it makes you, if you have spasms within obturator internus, you can get some burning when you go to pee, but also it causes, for anyone who's had sidewall endometriosis, typically you have obturator internus spasms. You can see the base of the pelvic floor muscles, right? That levator ani muscle group, right? And that serves, Amanda's going to talk about really what that part of the pelvic floor is going to do. She knows it's going to be like a quiz today. And then you can see these pelvic floor muscles that really come off of your pubic bone, come down, sling around your rectum, and then come back to the other side of their pubic bone. So if you have constipation issues, or if you have issues and pain getting stool out, and bloating, because if any of this is tight, it's gonna make you bloat, then I just wanted everybody to see this. And I'm gonna stop the share and go back. Amanda, if somebody wanted to do a little internal work in the pelvis, and they've telehealthed with their pelvic PT, so they know probably what muscle it might be, how would they begin?
Sure. So I recommend starting with, well, first of all, it's going to be dependent, like you said, on size and comfort level, whether you start with this end or this end. Each end could be used vaginally or rectally. It just comes down to personal preference. I like to recommend starting with the small size. So if we come and we look on the undercarriage here, again, we see urethra, vagina, and rectum. So you can just gently start on the outside here, what we call the introitus, and you can be gently doing some circles and then gently glide it in. Lots and lots of lubrication. I recommend 1 to 2 tablespoons. Just throw down a towel. It's better to have too much than not enough. And so then you're going to come in and hook in. And now I'm going to come onto the underside here. And so with your wand here, you're coming in this way. So this is the, you're laying down, and this is the underside of your pelvic floor. Here comes the wand, and it's swooping into the side. That obturator internus, as Sallie was showing you on the flat image, is all the way out here on the side wall of this pelvis. So the first things that you're going to come in contact with are the more superficial things. So you can just gently sweep and glide here. If you find a point that is tender, similar to if you found a knot in your shoulder, what you're going to do is, regardless of what side you're using and regardless of what item you're using, what I tell people is you're never going to push any harder on that tissue than you would use to check a tomato for ripeness. So just likewise, you wouldn't come in and push so hard that you pierced your tomato. the same thing with the wand. So you're going to come in, check that tomato for ripeness. When it's tender, you're going to hold it there. And here you are laying on your back, and pretend that these are your knees and your knees are bent. You're going to gently rotate your knees in and out, depending on what side you're on, until you find a position where the pain goes down significantly or goes away. So say you're rotating and you feel better right here with your knee rolled in. You're going to hold that for a minute or two while you're still making contact with that tender point. And then you'll bring the knee back and sweep back on through. So we're introducing blood flow, and we're getting the trigger point to relax and let go. And then you'll sweep on through and continue on to the next point. So just getting familiar with your body, especially the first couple of weeks of learning, you know, we don't necessarily have a map on this inside of our body. So learning where your body is, learning where your tender points are as you're sweeping through. And that way, as you do this more often, you're able to go right to those spots. And what I found is that after the first or second week, they're never as bad as they were. You know, the trigger points become less. We're working on learning how to relax the pelvic floor, better mechanics.
Not always in the endometriosis population, but they usually tend to get a little bit better. I want to point out something that Amanda said to everybody. We're bringing more blood flow there. We're adding more function, and we're moving you. We're not just mash against the tissue. So when the wands first came to market, all wands, not necessarily Amanda's, that was the thought, that we'll bang against the tissue and we'll hold it there and we'll create a hypoxia, which means an absence of oxygen to the muscle tissue. And then when we remove it, oxygen will rush in and it'll be all fine. We know that that's not really how to treat this area of hypersensitivity. We're not even really using the word trigger point as much in practice. We use it here because we know that you know what the word trigger point means. But it's about bringing blood flow, stretch, length, and movement to the area. So the link will be up on Facebook. The link will be available. I want you all, if you're going to use it at home, in her videos, she shows it. But I want you all to realize exactly what, it's a routine. It's not mash. Like, it's not like taking, somebody once told me, oh, you take a lacrosse ball to your piriformis. No, it's about movement. It's not about mashing the tissue, right? And so for anyone, we'll give it multiple times, but if you're looking for, because you can't get to pelvic PT, the pelvic wand is available at intimaterose.com, and you can use my first name as a code. They've offered us a special. The code is SALLIE. But how else? So do you feel that it's people treat, that's obturator internist.
Right.
I sometimes have, if you're not used to using the wand, that you begin with those transverse perineal muscles that I showed, those first muscles. Do you have any good tips for dealing with that?
Yeah, absolutely. You know, that's the beauty too of having different forms. You can use the more blunt side on that transverse perineal here. So coming back in, the transverse perineal being these two that come basically from right underneath the opening, that kind of more dense area, all the way out to the sides where you sit. And you can use a pointed side if that feels okay to you, or you can use the blunt side here and just be coming in and through and through. And I think that's too, we're having the vibration component. So I'm going to go ahead and turn this on so you can hear it. So you turn it on and you turn on the vibration. I don't know if you can hear that. I think it's probably attached to me. But there's 10 different frequencies, but you can get the vibration on and then just be coming in. I'm sure you can hear that now, but just compressing it along the transverse perineal. You can even give it a little pause and then compress out to the sides like this, coming on either end. And that's going to stimulate the blood flow, as we talked about. It can also just help relax the muscles at the opening there. When we address the transverse, the superficial muscles, as you said, oftentimes that has a direct effect on the next layer on the inside. So we have a lot better effect too of starting that way.
What I like with the, well, I like vibration for a whole different reason. So that's a different conference. That's a different webinar. I'm sure
we'll do that one too.
But So what I like about using the vibration is we talk about nerve upregulation in people with endometriosis, in that the endometriosis lesion has laid down and then the pelvic floor spasms are reactive to a protective mechanism.
Yeah.
So for years and years and years, I hated dilators and wands, really until I felt yours in my hand. But what I like about the use of the vibration is it's another message to the brain that isn't pain. So that is something we can, you know, sometimes just that wave that you're showing on the outside is very, very good, because you can calm that direct response to the central nervous system and have that connection between brain and pelvis a little more than mash the tissue, which you don't do with yours, but other people do. But mash the tissue, it's sort of that calming effect for the central nervous system issues. The only like little side thing I have is, I could pull it up, but we know that for those of the people out there with endometriosis who also may have the hernia / nerve compression, the ilioinguinal and the genital femoral, the genital branch in particular, they innervate the labia and the area next to and alongside the clitoris. So sometimes vibration feels really bad. If you have a nerve compression, putting different sensation into the nerve doesn't feel so good. So those are the people we like to use the vulvar balm. We like that, we treat those a little different. So when you're at home, that's why I like you to work with a telehealth practitioner, but to be aware that this could be something going on also. Okay, don't forget you can ask your questions in the Q&A. So if somebody were constipated, which we see a lot, how would you treat that at home?
A couple different ways, and it comes down to preference and comfort level, and your ability to self-treat and your coping strategies around that. Obviously, in telehealth, we're addressing diet and mobility and mobility of their spine and their, you know, rib cage and all that good stuff. Ideally, first we would start vaginally with a vaginal approach with the slender long end here coming in to the vagina and targeting the muscles. I'm going to try and get it so that my light's hitting it just right. Okay, so here's the tailbone, the white guy here, and then we have all of the muscles coming along the back side with the vagina in the middle. I'm going to come to this view here. So you can see here where the vaginal opening is here. So if we can take this wand and come down towards the tailbone and be gently sweeping along those muscles there to release the muscles. This is kind of a nice view too. This is such a lovely piece of art, but it's showing here, pubic bone, and it's showing how these muscles come and attach. This is nice because there's the different colors. The muscles that come and they come all the way forward. So we can address it forward at the puborectalis underneath the pubic bone here. So if this is the vaginal opening coming here and addressing the distal attachment up and under the bladder, or coming down and sweeping down towards the tailbone and addressing it there. If the vaginal,
so if you've had a lot of bladder endometriosis, it's not going to feel great to come up against that pubic bone. For the PTs, it's pretty easy to go ahead and to do that. When you're at home, Amanda is just about to show us the second way of doing it. She was where you're in the back towards the rectum. The only thing that you have to be careful if you happen to have rectal nodules of endometriosis, and you'll know right away because when you press them everywhere, hurts, and you haven't had an excision. If you've had an excision, it's a little safer, but I would stick to the second version. Can you go ahead and show what you were about to show us?
Yeah, so coming along the back end towards the tailbone here, you can also go rectally. If you are having comfort and you're not, you know that you don't have a bunch of nodules there or you've had excision, you could stick the slender end into the rectum here and just gently, so if we're coming in here and then pretending we're superficial here, so like 1 inch or so in, and just gently sweeping around the coccyx end there, find a trigger point, wiggle the leg, tomato touch compression, and then moving on.
And what is it? So you have a history of a lot of coccyx pain. What does it feel like when you do that?
Well, it's pretty unpleasant. I'm not going to lie. I try to treat for myself. I try to treat vaginally whenever I can. But I will say, once you find the trigger point and can get the leg into that, I mean, just a rotation in, the pain goes away and it does stop hurting. So I think the reverse sensation of having something go against the sphincter and having something enter the body is, for many people, it's just uncomfortable. It sends a message to your brain of what is happening here. I'm used to things going the other way. This is how we have a bowel movement. So having that come in for the first few times can feel a little off-putting, as a patient, I've been there and I know.
I try to have patients start with doing that back part of pubococcygeus and puborectalis vaginally, because I think they are so, like, nobody wants to do that to themselves. I know your tool it's better, the shape of it, but nobody wants to do that to themselves. But it is something people do. We're going to pause for a second. They're looking for somebody is 5 weeks post-op from excision and looking for telehealth recommendations. So this is what I have to say. You have to, because you probably haven't had all of your post-op visits with your excision surgeon, you have to work with someone who knows the ins and outs of excision. Like I am in the ORs all the time, so I get that. I am doing telehealth, but I would call the excision surgeon's office. They'll have some sort of service there that'll be answering your questions, and ask who they recommend. And then you'll just have to go down the list and find out who's doing telehealth sessions. That the advantage of telehealth has been that somebody who's really experienced like me, or somebody who's really experienced like Amanda, we've been able to see from everywhere now. So there are a lot of PTs that you're able to get into as telehealth that you weren't normally able to get into, which it's an upside to a very scary situation. But that's what I would do. Unless you know it's somebody that works a lot with endometriosis, I would call your doctor's office. Are there any contraindications for somebody who has surgery using the wand past 6 weeks of healing? So I'll say the endometriosis, I don't like if you've had rectal resections or rectal work. I don't like you using the wand rectally for 12 weeks. But vaginally after 6 weeks, I usually let people, I like to work with them for like 2 weeks first, but there really aren't that many contraindications. Are there contraindications to the wand, Amanda?
Active infection, and then just as you said, that time parameter, I've usually gone closer to 8 weeks, but it's out, you're doing 6 and then treating them 2 weeks and then going at the 8 week mark. So I think we were both in alignment there with right around 8 to 12 weeks of tissue healing.
Yeah. I think, the other thing is in my crowd, if you think that after years and years of infertility, you may be pregnant, I don't love to do internal work on those patients. So if you've been actively, which you have to be active in some way, if you've been actively trying to get pregnant, we don't like to take I don't use the wand in those patients. I know it's not a risk. But you can do tons of the external work. And I would say people that are asking questions that are 6, 8 weeks, they haven't had rechecks or anything like that, I would do some of the external techniques, and those are on the video library, right?
Yes.
Yeah. What is the best way to clean the wand? Especially if you're using one end rectally and one end vaginally. How do you recommend cleaning?
Really good question. So warm water and soap is how the wand is cleaned. If you do intend to use one end rectally and one end vaginally, I err on the side of caution and say use a condom over the side of it just to help protect it, or buy 2 and have one just be the rectal end and one be the vaginal end, just on the off chance that you missed a little corner. But the materials have all been tested as to clean with for single user with warm water and soap.
Yeah, so I want to tell everybody out there, we were discussing pH and moisturizers. Somebody has put a study in the question and answer box. If you all, for some reason, I can't copy and paste it into the chat box, but you're welcome to go in there. If you're looking for more information on the pH of different moisturizers and lubes, you can find it there. So what else? I saw someone yesterday with vulvodynia who's over telehealth, and we were talking about ordering the wand, but what advice do you have that maybe they've had their endometriosis surgery, so they're feeling better from that, but the vulvodynia patients, they need the PT all the time. And so now no one can get to PT. What advice do you have for home products for vulvodynia?
Absolutely. So our Vulvar Balm, as you mentioned, is really lovely. It's organic. It has all kinds of really good healing properties in it. Another brand that has a little bit of lidocaine in it is Desert Harvest, just to get you through, you know, it's a little bit of a numbing agent just to help those moments where, you know, your underwear is uncomfortable, everything's uncomfortable, don't want to touch anything. So Desert Harvest Relivium has a little bit of over-the-counter lidocaine in it. And then using the wand gently in the vulvar region. Again, you can be really broad coming in through there and performing those mobilizations just to make sure that that tissue stays freed up.
Right, so I had a recommendation in that the adductors insert on the fascia that goes to the pelvic floor. I wonder if everybody's gonna be patient and you'll let me look. We can see if we have that on the illustration site. Again, this illustration site comes from the Global Pelvic Health Alliance membership site and Pelvic Guru. Yes. And I wonder if she has it on the hip one, maybe?
I think she does. Yeah, I think there's a really nice one. I think I actually downloaded it the other day of the adductors.
So, that's not it. That's the back. Actually, this one's not awful because the exercise, I'm going to, so we're new to showing the illustrations. These are from Pelvic Guru, but I wanted to show you, all of this is adductor. And the way that the adductors insert is they actually insert onto the pelvic floor, which we may have here or we may not. So it's, and that these you can mobilize from the outside. You could you could mobilize it. I've had people do it with their hands. So they actually are, this is called strumming, but very gentle going on those adductors on the outside. You could even use the Relievum and the lidocaine there, because sometimes rubbing the balms on there, or Aspen Green was on with their CBD balm last week, but that rubbing the adductors with the balm will change the signal into the brain and relax the muscle. And then sometimes you can take the vibrating one, and the same way we showed the sweeping on the outside of the transverse perineal muscles, you can sweep against the adductor muscles. And that can be tremendously helpful, because when you have vulvodynia, oftentimes the thought of sticking that wand in there makes you really almost agitated. And even if you're not admitting you're agitated, you're a little agitated. And so working somewhere else. And then I have people do a lot of, we call it ring sitting, or you can do a little bit of gentle warrior. I like to have people not hold the stretch, but to move with the stretch. So I tell people that when they move into warrior, I actually, in telehealth, I do it with a count. I tell them 1, 2, 3, 4, out, 2, 3, 4, so that they're moving and you're lengthening and then you're contracting, and you're lengthening and then you're contracting, and you're letting there be what's called overflow to your pelvic floor. We had a question. Somebody says, what is the difference between the dilators and the wand?
Sure, that's a great question. So the dilators, I'll grab them real quick just so that I can demonstrate.
So again, we're here to answer your questions as best we can, because we see this as a huge issue that you can't get to care.
So two different functions oftentimes used together to get at a common goal. The dilators are intended to train the pelvic floor and to train the brain and to train the body to be able to tolerate penetration of some sort, whether it's a tampon or a speculum or a partner for sex. The dilators are intended to be a device. Now, certainly, so here's one of our dilators here. So you can see in general, dilators, here's the lineup here, are straight. And ours are made of a really soft, smooth silicone as well. But what we're doing with the dilator is we are practicing to relax and drop the pelvic floor. Certainly we could be performing some gentle soft tissue mobilization with the dilator, but we're training the muscles around the vagina and around the pelvic floor to be able to relax and tolerate penetration. And oftentimes we're doing what we call a low load, long duration hold, which would be about 15 to 20 minutes, where we are actively working on learning how to relax and keep the pelvic floor in a nice relaxed state during the penetration process. That can be used. Go ahead.
I want you to show one more. Can you put your hand on it and show how squishy it is?
Oh, sure. So here, so it's, I mean, I can come, it will hold form, but it will forgive as well. So we've got some movement, but, you know.
So for lots of us out there that have been in the pelvic pain game, having pain, that's not what they look like. They looked, even 3 years ago, they looked like hard plastic, scary things. And so I want you to see the evolution of the dilator, and that we shouldn't be so scared of them. I try to avoid them if you've not had an excision because of rectovaginal endometriosis. But I just want everybody to see while she's using it how different they are. Sometimes like your PT place will say, here, buy this for $10. They don't look like this.
Yeah.
And so this is more natural to what the pelvis can expect. And really more gentle on the body. I don't get anything for, you know, I'm just trying to explain that dilators have come a really long way and we don't have to be afraid of them. So for people that are like, oh, I can't do anything, I can't even tolerate a pap smear. First of all, these can be used externally on the pelvis. We've demonstrated that a number of times. But the other thing is that these aren't like even tampons in some ways are harder to insert than some of these. Yeah.
Yeah, because of the outer covering, you know, cotton can be unforgiving, especially if we're dry. Our finish is really soft and smooth. It was really important to me that we have that.
Yeah. How did it come about that you wanted to develop these softer dilators?
I jumped off a cliff. No.
I know the whole story. We know the story.
You know the story. Yeah. I wanted.
Tell people what the originals felt like, because you must have felt the originals.
Yeah. The hard plastic was unforgiving. It was very medical. The feedback that I got, I mean, outside of me being a healthcare provider and being like, okay, this is the thing, we do the thing, I use the thing, is that, you know, people were embarrassed if it was found, because it's like pretty clear what it is and what it does. Or even just like looking at some of the white ones, you know, if they had any sort of discharge from their body, it was highly visible, and it just all that feedback comes back and it kind of interferes with our perception of ourselves. So I wanted something that was really fun, and that, you know, if somebody found it, well, it's a squishy holder, you know, right. That you could explain it away if you had to. But the finish was the most important thing to me, especially for my cancer patients that were just getting that new slough being built back up in their body, that were being really gentle with the removal of the dilator. Sometimes getting it out is harder than the getting in process, if you can believe that, coming from a pain standpoint. So gentle on the body.
Yeah, and I think I was watching, because my whole life is watching TV now, but I was watching Unorthodox. I don't know. I've had ties to that community, but it's amazing to watch. And one of the the things that they do, there's a discussion about vulvodynia in there. That's horrifying. It's totally horrifying. And it's totally like that in that community. But they hand her a box of the old plastic white ones and say, stick this in. And she's, you know, you can see that she's mortified by the whole thing. And when I'm watching it, I'm like, oh, I'm going to have Amanda on tomorrow because we have changed. Because if you look at your pelvis like it's only medical, then it stays only medical. And so a lot of times I don't use any dilators because I don't want that from somebody. You know, we want to associate pleasure. So I think also them being softer, them being more colorful, there's a better association with the pelvis. We have just a few questions. Somebody says, what to use first, dilator or wand? In my practice, it's always wand if it's going to be anything. I do that with the endometriosis crowd. But here's the thing, if you can get to a telehealth PT, they will help you decide.
Yes. Yep. Highly individualized. I tend to do the same thing, wand first, then dilators. But I have had patients come in already with their dilators and they've already started the process. And, you know, I check them and it really is, they don't have tender points to speak of and they're doing fine with the dilation process, but absolutely. And that's where having somebody guide is highly beneficial.
Yeah. And I don't, especially because the labia and everything else, the skin on the vagina, that's all innervated by both sensory and motor nerves. You know, it takes two that we don't shy away from telling you have to take care of the skin that's there. Meaning that sometimes dryness, so if you're dry because you're post-hysterectomy or you're perimenopausal or you're postmenopausal, taking care of the dryness, sometimes that's a whole different thing. But if you need a hormone, you may need a hormone, you may need a custom compounded suppository, you may need the, you know, using a vulvar cream is a great place to start. Because if your skin is not well taken care of, then the nerve actually spasms the pelvic floor. Do you see that often in your practice?
Absolutely. Yeah, definitely. The dermal health is so important.
Yeah. So we have one very, Tiffany is asking about pain at the 6 o'clock location during, intercourse. My first answer would be, did you ever have an episiotomy? And is it the episiotomy scar? So she says no, she's good, this Tiffany. So I wonder about also what is the health and the stability to the perineal body itself. That I try not to be so focused just as I stick my finger out to touch it like I'm sitting here with you. That I try not to be so focused just on that. But what are your ideas about what's there?
Yeah, I mean, sometimes there can be some density here from clenching, and coupled with if there is hormone changes, especially if they've been on like hormones with birth control and like changes in meds and going, you know, surgeries and these kinds of things. There can be changes to the rigidity of this area. So, you know, gentle finger stretching where you just come right inside and just gently compress down and hold it for 30 seconds. It can also be done with a dilator, whereas if this is the vaginal opening here and that's that density, just coming in and just gently compressing here to get flexibility of it. If you can imagine that if your legs were really, really tight and I asked you to just run as fast as you could, the muscles would spasm and you could possibly strain the hamstring. Similarly to where we have here, if there's rigidity here and then we're looking at penetration from something, that the fibers can get strained there. So gentle mobilization.
The other issue is if you've had a lot of like rectovaginal endometriosis, uterosacral endometriosis, even rectal endometriosis, the muscles have responded inside in reaction to that. And so you may be gripping in that area, or your perineal body may be used to splinting you against your stool. So it's hard to answer over here, but these are ideas to think about. Well, this is a great question for you. What products do you recommend for vaginal dermal health?
Well, our vulvar balm is ideal. The Enchanted Rose, obviously I'm partial to it. I specially created that to be allergen free of all sort and organic, and it's just a really nice consistency, and it's meant for that dermal health. As we've talked about to Desert Harvest, Relievum does have a little bit of lidocaine if you're looking for that. There's other really great brands on the market. Rosebud.
We have Rosebud Woman was a sponsor last year.
Yes.
They do a great product, especially for the perimenopausal that's like looking to save their hormonal balance there. And listen, I'm not gonna lie, I've had patients where the pharmacy needs to custom compound something with hyaluronic acid in it to suck moisture in there. It happens. So, you know, you really need to work with somebody. This is a great time because practitioners like Amanda, like myself, we can work with you over telehealth. But somebody like Dr. Ahmed or the pelvic physiatrists that work with these bombs, or Dr. Gittins also does a lot of pelvic dermatology, Dr. Balani, some of these bigger names in the US, they're all working telehealth now. So you're able to they're accessible to you when they're not normally accessible.
Absolutely. And there's some great data coming out on that hyaluronic acid, you know, compounds that are being done in pharmacies, and sometimes a little bit of estrogen in the appropriate patient can do wonders.
What is your thoughts on vaginal Valium and when to use it? You know, do you use it before you use the wand? Do you use it before the dilator? Do you use it after? Do you use it at all? What are your thoughts there?
I will be totally honest. I have yet to see it work on a single patient. I've had several patients being prescribed it and coming in, and I have yet to see it work with a tool, with a partner, I've not seen it be effective in any of my patients. Have you had any good effects?
No, I have a totally different experience.
Oh, really?
I've seen it be effective. I would say probably 80% of patients, but I don't ever have them use it as the only thing. So how do we know it's that, or if it's something else? Right. But I think it's very effective on the post-excision patient, because they put this Pelosi in to do the endometriosis surgery, and then that spasms their pelvic floor. And then you need the PT anyway. But I use it probably the way we're not supposed to tell patients to use it, as a rescue remedy. So my pelvic floor is in spasm, I'm too lazy to go to someone, I have too much to do, whatever, and I'll put half in, and I see it. And I've tried the CBD ones, and it's not as effective. And I've tried just using the wands, and I don't think it's as effective. And I think it's interesting though, because you're not the only PT. You do a lot of sports medicine in the pelvis. And
it's not like that's not like my primary population, though I do tend to see those higher functioning athletes, but even just in my like normal regular pain people. Yeah.
Now, I don't like to have people put it in before using the dilator or wand, because I'm worried about infection. What are your thoughts on that?
Interesting. Yeah, I think absorption, I don't know what the absorption rate would be. I would think there would need to be like a window of time there. One thing that I worry about too is if we're forcing a relaxation, then we're not getting the brain work done. So, I mean, I agree with you that maybe not coupling them right back to back, but also like leaving a big enough window to where like the brain is still actively in control of that drop, so that we're getting the long-standing work done.
Yeah, I agree with that. That brain work is usually why I don't always recommend a dilator. But also I feel that like I don't, the same thing with the fertility patients, and I've talked to Dr. Vidali about this. I don't love putting a suppository in, letting it dissolve, and then sticking anything in there for infection purposes. Yeah. Because they're based in something, you know, they're not, so, you know, what is your opinion on using, I know people do it, but using the dilators before sex to open the pelvis. Like, are you a fan of that, or not like a fan, but a fan of clinically?
I have had some people get really good results there. As you know, if the dilator is clean and they're putting it in and they're using it for, you know, like a little like pre-game warm up, then, you know, they're taking it back out. Usually the vaginal wall has enough of a protective layer of it to prevent against any infection, you know, that it wouldn't be any different from if they hadn't dilated, if the dilator is cleaned properly.
Yeah. So we have an interesting question. A lot of the back pain in endometriosis patients is driven from the uterosacral ligaments, and then the pelvic floor is spasmed around the uterosacral ligaments. But we have an awful lot of pelvic health patients at home right now who have pelvic spasms and have terrible back pain. How do you think the pelvic floor plays a role in back pain?
Yeah, so many ways. It can change our posture. It can change how we're holding ourselves. When we do go to move, when the pelvic floor is bound up, so say this is the pelvic floor and it's gripping and the pelvis is altered, it's going to change how we move our back. Also, tender points in the pelvic floor can refer into the back. So it's so many numerous different ways outside of also pulling on those ligaments.
Yeah. Do you see people have relief of some back pain by using the wands, or do you see it more as just a tool in the million steps that you need to use for back pain?
It is a cog in the wheel for sure. It's one of the many things that needs to be done. But I think when we free up the pelvic floor and we're relearning those pelvic mechanics, it's going to feed into the back health too. But certainly when we're changing the brain's relationship to the pelvic floor, it can change how we sit, how we go to move and stand up and bend over and all of that. But relearning those mechanics often takes working with a PT to learn what was faulty versus what is a safer, more effective way.
I don't know, but on the Intimate Rose video library, you show how to use the tools for people that need some help at home. Do you show some simple exercises for integration, like what I call brain integration, after you've used the tools?
Yes, in our guide to pelvic floor release, I show a couple of different stretches that can be helpful for relearning how to drop. And so it's all created into one guide. I mean, there's several different videos, and then there's one guide on pelvic floor release where it's showing how to use the wand, and then it's a video on different stretches that can be done after wand use or in conjunction with wand use.
Yeah. So we have a question, and then our hour is almost up. We have somebody wants to know, how do you choose between the vibrating and the regular one? And so I had that whole thing of, do you need the vibration as a different input to your brain? But how do you advise people to choose between the vibrating and the regular one?
Sure. Generally speaking, if someone does not have endometriosis and has just had a surgery or some other form of intervention in the pelvis, I recommend the vibrating wand to get that blood flow into the area. I think working one-on-one with pelvic PT to help understand where their excision removal was is helpful in determining that. But in general, I tell people, if massage feels good to you, if you've sat in one of those vibrating chairs and it feels good on your body and you don't have this kind of clenching response to it, then vibration is probably going to be a really good tool.
So oddly enough, Dr. Vidali and I have had this whole conversation because people come in and they ask us everything and what's safe after excision. And so if you're somebody where vibration is going to feel better, it is safe after excision. But anything you stick in, it depends where you've had your excision. Yeah. We're sort of in a crazy situation right now where we're giving, we're not giving advice, we're giving options for things to people to use at home. But I think if you're past that 6-8 week range, it's plenty safe to use vibration. Quite frankly, I've had patients call me and want to use vibration for other reasons, and the excision surgeons have cleared them no problem. So that goes into that too. I think for people who have more of that, a lot of vulvodynia to me is just nerve compression, but they have more of the vulvar symptoms as opposed to the pain within the pelvic floor. Vibration makes a little bit more sense. Do you feel that way?
Yeah, definitely. Yeah.
Okay, so lots of people asking how we can get a hold of any of these tools because lots of people suffering at home.
Yes.
You can get a hold of everything through intimaterose.com. They have created a code, SALLIE, or Sallie, which is my name, to make it a little easier for you to get everything. I don't know. There also came a code in the Endometriosis Summit bag. I think it still works, but I'm not sure. And this is something that you can use at home. You're looking for home telehealth PTs. I would recommend Amanda. I'm also, Amanda, how can they reach you professionally, not for Intimate Rose?
They can still reach me at support@intimaterose.com.
Excellent. And I'm Sallie Sarrel.com as well. You can get me Dr. Sallie PT on Instagram or through Facebook, which is, everybody knows how to get me through Facebook. And then the other thing is you can try to go through the Global Pelvic Health Alliance membership site and see if PTs in their profile list telehealth. Also, the Pelvic Guru or Pelvic Guru 1 on Instagram may have more names for you of people who do telehealth, and your doctors may have names of people who do telehealth as well, and who have experience. If you're working with a practitioner right now and they're not able to see you, it's a good idea to call their office and to see if they are doing telehealth because they know your body. And that's all we have. So let's update you on what's going to happen this week. We try to come to you 3 times a week. You're welcome. We have lots of exciting things going on. We have partnered with Dr. Stephen Palter. Dr. Stephen Palter is connected with a doctor in Wuhan, a doctor in Italy, someone on the White House Medical Advisory Board, and fertility centers across the world. And he will be delivering a COVID and infertility seminar on his platform, which is not Zoom, but we will get you the information. We will be partnering with him to bring it to you on Friday, probably instead of our exercise on Friday. And that is a huge thing. Please follow Facebook, the Endometriosis Summit, and we'll try to put it on Instagram if he gives me the link in an Instagram-friendly graphic. And it should be fantastic. It's geared towards the patient voice, but he gets up to 1,500 fertility specialists learning about COVID a pop. It's a great opportunity, and that is on Friday. On Thursday, the expectation is that we'll do our first Instagram live with Dr. Vidali, and you never know what's coming out of his mouth. So we don't want to miss that. And then if we have time, we'll also bring you an exercise sometime this week off of Facebook. I encourage you to follow Intimate Rose. I want to thank Amanda so much, not only for being here, for creating a great product, for giving us a code so that we could help people at home, which is super duper important in this time. We've had Amanda and Intimate Rose hand out a code to help patients at home. We had Aspen Green also do Endo 20 for CBD. Lots of companies out there are looking to help you. And you can reach out to us and ask us anything that you need. And it can't be like a 6-hour answer, but if you need resources, we're happy to provide that to you. So we'll see you somewhere on Instagram. We will announce the time on Thursday, and please don't forget to see us on Friday for the infertility webinar. Thank you, Amanda.
Thank you, Sallie. So good to see you.
You too. Hopefully we'll see you for next year's summit.
I'll be there. If we're going to be there, I will be there.
We'll see. Take care.
You too.